Hello and welcome to your session on chest clearance. I'm Annie Pritchard and I'm one of the respiratory physios. The aim of the session today is to talk about what is chest clearance, why do you need to clear your chest, what is mucus, what are the causes of increased mucus production, and how to clear your chest. Your lungs have a natural way of clearing themselves. It's called a mucociliary escalator, but I'm going to explain that a little bit simpler than that. Your lungs produce about 150 mils of mucus a day, which is a beaker. Now that can sound a lot, but when you consider that the surface area of your lungs covers a whole tennis court, that beaker becomes a very, very thin layer of mucus. It's designed to trap any dust and debris, foreign particles that you breathe into your lungs and clear it out. Your lungs are clever at trying to keep themselves clean. You have fine little hairs in your lungs called cilia. They have the mucus on top of them. The mucus is then wafted by those cilia to go from small airways down at the bottoms all the way up to the top. You will naturally then either swallow or cough to expel that extra mucus. This happens whether you have a lung condition or not. So your lungs naturally produce this mucus. It's gelatinous. When you're well, it's often white, clear, sometimes even a little bit grey or opaque. When you're unwell, it can change colour and become dark yellow, green or brown. Mucus can be referred to as lots of different terms. Phlegm, secretions, sputum, they all mean the same thing. So for the purposes of our education sessions, we'll refer to it as mucus. Some conditions, lung conditions, don't produce extra mucus, and you may be wondering why you need to know this. But if you were to get a chest infection, it's important you understand how to clear your chest well to reduce the length of that chest infection and reduce any other side effects or complications. So please keep watching. It's important to clear excess mucus when it's in your lungs, be it from an infection or as part of your normal lung condition. Mucus in your airways, a bit like any substance in a pipe, forms a short-term obstruction. It will reduce the airflow to that part of your lung. It might make it feel harder to breathe, that your chest feels tight, or just simply rattly as you breathe. But by clearing it, you reduce your risk of further infection, and you actually reduce further damage that might happen within your airways. So the best way to keep your condition stable and you well is to avoid infections, or at least shorten the time that you have a chest infection. Some of the causes of increased mucus production within your lungs, apart from infection, are smoking, pollution, your lung condition, viruses, coughs and colds. No matter what the cause is, as I've said, it's important to clear it. So we're going to look at some of those ways now. There are 5 ways that we're going to speak about. The first one is hydration. Hydration is important because dehydration will reduce the action of those little fine hairs, those cilia, by 25%, which is actually quite a lot. You can become dehydrated not just by the hot weather, but also if you're unwell or you simply don't drink enough. The best way to know if you're drinking enough is to monitor the colour of your urine. It needs to be pale straw colour. Anything darker means you need to drink a little bit more. Perhaps the best way to demonstrate the difference that hydration makes is to think about a blob of jam. If you were to throw it at a dry window, and I don't recommend doing this at home, it will stick. But if you were to throw it at a wet window, it would slide. It's the same within your lungs. If the airways in your lungs are dry, the mucus will stick and it will take a lot of effort to get it up. So actually, a little drink or using moisture, so it might be old-fashioned hot water in a bowl and a towel over your head, staying within a shower room that little bit longer when you're doing your breathing exercises will make it much easier to clear that mucus. The next thing I want to teach you are breathing exercises. It incorporates the diaphragmatic breathing we talked about last time. So diaphragmatic breathing with relaxed breathing, huffs and a cough. Now we do these in a cycle fashion as a way to help move that mucus from the lower parts of our lungs up to the top. The deep breathing, you should remember from last time, So it's taking a breath into the bottom of your lungs, holding it for a second or two, and then relaxing. You can add an additional sniff in here, and that's to get that last little bit of air in. So deep breath in. And that just gets that little bit more air behind the phlegm. It's important after doing 3 or 4 of these deep breaths to do some relaxed breathing. It can help offset any dizziness that comes from those extra breaths, especially if you're not used to taking deep breaths. Relaxed breathing is as it says on the tin, just like you're sitting down, watching TV or reading a book. Nice calm breathing, and it only needs to be 10 to 15 seconds. Next we do the huff. Now to do that, you take a medium breath in, and then it's a forceful breath out. I'll demonstrate. So you're using your tummy muscles to help push that air out a little bit more. It can help to imagine you steaming up a mirror or glasses, but try and imagine that mirror's moved a foot away. So you have to work that little bit harder to steam it up. Are you ready? The huff forcibly helps move phlegm from the lower areas of your lungs up higher, ready for your cough to be able to clear it out. Now you have about 28 divisions within your lung. The cough will only clear the top 5. So that's why it's important to get those deep breaths and the huffs to help get any mucus within reach of the cough. So for this reason, we go through the cycle of the deep breaths, relaxed breaths, deep breaths, relaxed breaths, deep breaths, and then the huffs. You may not need to cough at each time, especially if your huff is a bit dry like mine. But if you do need to cough after doing a huff, please do. And you carry on through the cycle until your chest feels clear, easier to breathe, or actually you've just had enough. But do try and give it a go for a good 10 to 15 minutes if you can. It can help to take your inhaler, like your salbutamol, 15 minutes before you do this, just to help open up your lungs that little bit more. Also doing it after you've been in a shower or a nice moist environment, that can help too. The next screen will show you that cycle. If you find that actually it's quite difficult to clear your mucus still, despite using those breathing exercises, it may be the mucus is quite low down. So we can use something called postural drainage to help us. And that simply makes use of gravity to our advantage. As a general guide, lying on your side is a good beginning place. So you want to choose a bed or a comfortable sofa. Try and be in that position for a good 20 minutes. That allows the mucus to just drain down a little bit more. If you imagine, sometimes mucus can be a bit like syrup. And if you put that on a flat surface, it needs to be on an angle for a little while for it to run to where you need it to be. So just bear with and persevere. If you generally have mucus throughout both sides of your lungs, you may need to alternate the side you're on. So again, 20 minutes on either side. It can be useful to do this in the morning and before you go to bed, but not after any meals. Another way to help clear your chest is exercise. So again, you're in the right place doing pulmonary rehab. When you exercise, you naturally take bigger, deep breaths. And the sheer force of those breaths coming in and out of your lungs will help waft that mucus up to clear. You may have already noticed if you go for a long walk or a run, you're in gardening, that you find that you cough out afterwards that little bit more. So we can make use of that through the exercise. When you do exercise, we want you to work at a good level of breathlessness. So as we've said before, you're able to talk, but you might need to pause to finish a sentence. If despite all of these other techniques, you are still struggling to clear your mucus, then it may be that you need some additional aids. We call these clearance aids or mechanical aids. They are only available through assessment by a respiratory physio, and that's something that your respiratory consultant can refer you for if needed. There are these positive expiratory devices that can help clear your chest, but as I've said, you need to be assessed for these. But there is one device that you can make at home that would do more or less the same job. It's called Bubble Pep. It makes use of a container, such as a 2-pint milk bottle or drink bottle. You fill it with at least 10 centimetres of water. We then put a large straw or wide bore tubing. That tubing needs to go right to the bottom of the water. And what you do is you take a good breath in and you breathe out, blowing a little bit faster than normal through that water. The pressure of that water creates a back pressure. That helps splint your airways open a little bit because it's resisting the air coming out. As your airways are splintered open, it makes it easier for the mucus to be cleared and you to cough out. So you can try that at home. It costs nothing and it won't do any harm. Just don't drink the water. Again, if you have any further information, you can look at the British Lung Foundation website. That's www.blf.org.uk. You can ask your clinician following the exercise session if you've got any specific questions about this education material. We hope you enjoyed it. Goodbye.